Gabrielle DeCompte. I am a medical doctor, and I'm also a doctor in Chinese medicine.
Okay.
I practice integrated type of medicine, functional medicine, that is based on nutritional health and dietary changes, along with doing a lot of modification in healthy lifestyle changes. I got involved with Dr. T once I met him and understood what his motivation was for establishing a skin clinic that was based on a not-for-profit organization for children, helping children in Nepal. So a lot of the majority of the funding that we get goes to helping these children out in Nepal. That was a huge emphasis for me to be able to give back to the society. And so today we're going to be presenting on some skin cancer information and also on colon care, colorectal cancer health. And I'll give it to Jillian if you have anything, because Brad will be talking in a minute, but do you have anything else that we should talk about first?
Well, did you both introduce yourself?
He's going to
Not yet.
introduce.
Oh, okay.
Well, okay, so I'm going to just let both doctors introduce themselves,
Okay.
and then we'll go over a little bit more.
Yeah. Let me see if this is working. Doesn't sound like it. So,
I'll just pass that back and forth.
for the video, but is it working for the video? Okay. So I have to do both here.
Put it on.
Well, we're going to
Or
need
you
to
hold-
do. I think you have to do this. This goes into the video, and this goes for them to hear. So okay. So Dr. T is not here. Sorry, there was some confusion. It was supposed to be the eco-Politan team panel of doctors, which is me and Dr. Gabrielle here, and we work for eco-Politan, which is Dr. T's nonprofit, and we're planning on talking about colon cancer and proper stool testing and techniques with that today, as well as the skin clinics that we do. And I recognize some faces out there from our skin clinics. So I'm Dr. Brad West. I'm a naturopathic doctor. I practice in the South Bay, in Los Gatos and Santa Cruz for about 10 years. And I met Dr. T at one of his brilliant talks 3 or 4 years ago now, and went to a skin clinic, had some moles and pre-skin cancers removed on the spot, and was just blown away at how effective it was, and that all his proceeds were going to this wonderful charity, Nepali children's charity in Nepal. So started training with him right away when he offered me a position. He's as you know, so busy and overwhelmed that with patients or customers that I took over the South Bay for him so he could focus on other areas in the country. Is this working okay for the video? Okay. Everybody can hear us in the back, okay? So I'm going to hand it over to Jillian, who's the area coordinator for eco-Politan. She's got some questions for us, and then I think we'll field questions from you guys if need be as we go along here.
Okay, so, let's see. Interesting. Okay, so as Dr. Brad mentioned, my name is Jillian Love. I've been working with Dr. Taloran for probably about 6 years right now, and I'm the coordinator for the San Francisco area as well as the East Bay. Some of you may or may not. Anybody has come to a clinic before? Yeah? Anybody has seen Dr. T speak before? Yeah. And as Dr. Brad mentioned, we are going to be presenting all Dr. T's material. Dr. T is at another expo today, so he wasn't able to make it to this one. But these are Dr. T's team. So Dr. T, as you know, has been efforting for years now to develop his skin clinics in different areas to provide treatments to remove moles, skin tags, skin lesions, and things like that, which the doctors will tell you more about. And all the money from that he sends to Nepal where he has the Everest Learning Academy, which is a school that's providing a safe haven and education for poor and orphan children and their families. So that's where the money's going. And since there's only one Dr. T and he's got lots of things going, he has started to now train other doctors so that he can continue to grow and make more money by having a team of doctors, because the money that these doctors make, a percentage of that is also going to Nepal right now. So that's the big effort on Dr. T's side, is to train a really competent team of amazing people to go out there and continue to do his work so that he can focus on growing it and keeping the project going. So it has a life of its own without him. So that we're really excited to have this team here right now. And I'm going to be asking some questions. It'll be a panel style with lots of things that are related to some of the medical things that you would have heard if Dr. T was here also. So now that you guys have both introduced yourselves, I'm going to start asking some questions. And I just want you to be a little patient, since we are passing one mic around between us, and we have to have this second little mic for the microphone for the camera. So we'll be doing that. So if you can start off, the title of this is skin cancer and colon cancer, epidemics that are happening. Can you both take turns in answering a little bit about what these epidemics are looking like and what you've seen going on from your perspective?
Sure. You want me to?
No, why don't you start?
Okay, so we'll start with talking about the epidemic of skin cancer and skin lesions in general. So in the vegetarian crowd, which I assume most of us are, we do see about the same incidence of skin and colon cancer, which we'll talk about a little later. Actually, I take that back, the colon cancer rates are lower, as we know, in vegetarians.
23%.
Yeah, 23% to be exact. And an interesting finding on that realm, or that in that area, is that pesca or fish-eating vegetarians had 43% less colorectal cancer. So, and I think they thought that was really the extra vitamin D and omega-3s. So definitely wouldn't be the antioxidants. So I think of the vegetarian diet as being really high in antioxidants, which Dr. T and all of us, really think is and we see really affects the skin the most. The antioxidants in plant-based diet, in particular, are going to protect the skin the most. And we like to remind people that skin cancers aren't just from the sun. In fact, Dr. T is famous for saying it's the sun and French fry diet. So, meaning if you're eating a lot of trans fats and rancid fats, and the raw foodists and vegetarians are not immune to that. We see a lot of nuts that are, what do we call it, dehydrated and roasted, et cetera. That's going to be oxidizing fats. And when you eat a lot of oxidized fats, so anything that's heated or cooked or stale, left out too long, over-processed, we're going to see a rancification of those fats. And we know we are what we eat, so what goes into our fat cells right under our skin is these rancid fats. And it's good to know, I think, and pass on that humans are one of only 3 mammals that have subcutaneous fat. So all other mammals have fat around their organs, whereas humans, crocodiles, and hippopotamus have subcutaneous fat. And that's important because as the sun hits our skin, it can oxidize or damage the DNA, and particularly of the subcutaneous fat layer. And if that fat is rancid fat, that DNA is going to be damaged and the cancer rates are going to go up. Or the skin damage. It doesn't always have to be cancer. So we'll go through some of the terminology with actinic keratosis, basal cell squamous cell, and the cancer rates, et cetera.
In addition to the oxidation process that's going on, that's causing the mutation and the changes in the skin, what a lot of people don't understand is antioxidant therapy is really essential, but if you're not getting enough in your vital organs, then there's not a lot of that antioxidant material getting to the skin, which is why the skin cancer rates have also increased throughout the years. And so it's so super important to be able to get proper nutrition that is high-grade nutrients and antioxidants within that. And that's why a vegan diet loaded with a lot of greens and colored vegetables and some colored fruits is so essential, because you're getting, and also the amount of healthy fats is so important, because that will entitle and enable the body to be able to use the nutrients in the cells, and then eventually enough of it will get out to the skin cells so that they maintain a healthy levels within the cells itself.
Yeah, good one. Yeah, so that's that French fry and sun diet. If you can get lots of sun, and I've seen that in my own lifetime, and probably a lot of you have in the last 20 years with the raw food movement, and this real kind of hardcore, super high, antioxidant-rich diet, is that people can sunbathe longer. We just don't see the burning. Maybe you had, easy burns when you were younger, and as you became a raw foodist, you noticed you could tan, and you didn't really get the burn. And that's important, because those antioxidants are protecting the skin in that way. So it's not so much being a vegetarian or avoiding the sun, it's the combination. And you should be able to tolerate lots and lots of sun as long as you ease into it and you develop a tan slowly and rarely burn and have lots of antioxidants in your diet. And on that fish comment earlier, that might be one of the findings that they'll find, is that it's the omega-3s in the fish, that actually omega-3s aren't just an essential fatty acid, they're also an antioxidant. So there's all kinds of complexities going on with diet and lifestyle that we need to be aware of. So, but some statistics on skin I think we should probably cover. So for those of you who just came in, we're Dr. T's eco-Politan doctors team, and we're talking about skin cancer and colon cancer and risks today. So some of the statistics, if I can remember off the top of my head, were, maybe it'd be better to read them.
I can read my writing.
Yeah, let's see. So I like to tell people, because it's not really a mystery, there's really 3 types of skin cancer. 2 are fairly benign, which means not too dangerous, and 1 is very dangerous, and that's melanoma. So the rates for melanoma are quite lower than the other 2. I think we're at 73,000 new cases a year annually in the U.S. of melanoma, and we'll come back to that. But the other ones are basal cell carcinoma, and there's about 2.8 million cases per year, and then squamous cell carcinoma, about 700,000 cases per year. So basal and squamous cell carcinoma have to do with more sun-exposed areas, and they're often you're often on the face and shoulder, and they have a different look and feel. So we'll talk about that. But they also what was I going to say about that? Well, I guess I'll just talk about what they look like. So squamous cell carcinomas are the one about 700,000 per year. They're the ones that are usually red and dry and flaky. They'll come and go for a few months to a few years, and then finally they'll stay, and then they'll slowly get bigger and bigger, and they can turn into sort of a bump, like almost a mole looking, but they're usually red and dry. More often they ulcerate and just kind of spread laterally. And these are the ones you see on older men's heads that and they're really red and flaky, and they almost always start with out as sun damage. And we know if it's 5 sunburns or more now in your lifetime, and more in childhood, the more significant, the more likely those are to occur. And they go through phases. Usually don't notice for decades, and then you'll see some actinic keratosis, which is a pre-cancer stage. And that's just because it's red or flaky doesn't mean it's cancer yet. But it's very likely on its way. And once it turns into a cancer, it's not like a light switch and now all of a sudden it's deadly or dangerous. Again, it's just another stage, and it takes a long, long time for those to become problematic. I would be amiss if I didn't state Dr. T's opinion on this, and I think we're all in agreement that you want to be very careful about biopsying these. So squamous cell carcinomas, or SCC, are very benign when they're on the skin, and they're very dangerous when they're in the bloodstream. And over 25 years and hundreds of thousands of skin treatments, Dr. T has seen only 2 or 3 people die, and that was from biopsied squamous cell carcinomas, and particularly punch biopsy, because you're putting those cells into the skin and you're causing an inflammatory response. So I don't know if there's any way he could prove that, but that's, he's a pretty smart and intuitive guy, and that's what he's put together. And it's really hard to find studies and to prove things like that, but we don't want to risk it, right? So rarely recommend getting biopsies at all anyway, and particularly with these benign skin cancers anyway, like basal cell and squamous cell. So do you want to talk a little bit about basal cell? Or am I just keep going on that?
Yeah,
so
you're on a roll.
Okay, so basal cell is 2.8 million cases per year, which is surprising to me. I see a lot more squamous cell, or what I assume is squamous cell, and maybe they are basal cell. So basal cell tends to be more pearly. At least in medical school, they teach you it looks like a rat bite with a pearly edge, so it can be a little bit ulcerated. They can also look like a large pimple or mole, kind of reddish. They don't really look like, your standard mole to a trained eye, but and that's something that we like to do is educate folks about that. So we have pictures that you got today of some of the type moles and skin lesions that we treat, and basal cell is on the bottom center. It says ulcerated carcinoma, and that one's really old, so it's bloody, been around a long time, and we actually fixed that one for that gentleman, whereas his doctors had said he needed to have a skin graft, and it was quite large, and we treated it really effectively in one treatment right in our little skin clinic. It takes about 5 minutes, and we'll talk about what that procedure is a little later. So I don't want to go on too much because I know we don't have a lot of time on the statistics and things, but just know that there's 3 types of skin cancers: basal cell, squamous cell, and those are very identifiable, very much in sun areas, very preventable with a high antioxidant, low rancid fat diet. We don't want to avoid the sun because the sun actually has a lot of vitamin D, and we see there's actually a decrease in cancer rates in people who get sun, as long as they're not overdoing it with a poor diet and sunscreens. So we're not proponents of sunscreens.
And genetics play about a 10% role in this. So it's not to say that genetics are not there, but 10%, 90% of the time is dietary, lifestyles, and behavior modifications going on.
Yeah, that's right, exactly. So what we're talking about really is epigenetics, common sense and epigenetics. So above genetics is our ability to turn on and off genes with our diet and lifestyle. And I think people get that here. That's why most of us are here. What else about that? I think we went through some of the rates. Any burning questions?
Well, I think, you've touched a little bit on the causes already and, some of the things. And then I was wondering if you could go a little bit more into what some of the natural interventions would be. And then maybe we could talk a little bit about some of the interventions that, conventional treatments, and then what we do also.
Sure. You want to start that? We talked about the prevention pretty much.
Yeah. So some of the natural treatments is mostly through diet behavior changes. Part of the reason why we're here at the World Veg Fest is because we really emphasize a diet high in green vegetables or colored vegetables and also fruits, lots of colored fruits as well, and essential fats, the healthy fats. That's the most important thing that you could be doing. Also, what's probably as important is to reduce your carbohydrate load and sugar load. So, not too many fruits is a better thing rather than eating too much. Is that most important is keeping the carbohydrates low. So, instead of doing pastas and other cooked processed foods, you could be doing a lot more of sweet potatoes or kabocha squashes, those kinds of plant-based food intake, along with a lot of the greens, and then good healthy fats. Lots of, I really emphasize coconut meat, coconut oil, unrefined, of course. I try to get it in the raw form. Avocados. I also emphasize taking a lot of the sprouted milks, so almond milk that's not found in the carton, so you want to try to find it in the refrigerated section. It's usually sprouted. It doesn't contain all of the fillers. You know, the problem with all of this advent of people trying to eat healthier, they produce these carton boxes of milk, but then they're loaded with fillers and water, and there's not even a lot of the actual product of the nut milk in there. And then a lot of the nut milks are not, they're still, they become processed, so you're not really getting a lot of its nutrient or rich enzyme, rich food in there. So it's very important to be careful and read labels of what you're actually ingesting. Sulfur, yeah. So we sell, Dr. T sells the Himalayan black salt, which is a high sulfur, rich based salt, and it's really important that it supports the liver detox pathways. One of the pathways of the liver is the sulfur pathway, and so supporting that also enables the body to be able to convert certain chemicals that we've ingested in the body. Either we're ingesting it, we're taking it in orally, or we're inhaling it. Or we put it on our skin, and so you have pathways of the liver, which include glutathione and cysteine and methionine and sulfur. So as long as those pathways are working, your body's able to convert any of these chemicals or hormones or xenoestrogens or xenobiotics into their proper state so that they can be excreted. But I'm going into too much detail because that's for another time. But I'm just emphasizing the importance of keeping your liver pathways open, and sulfur is one way of consuming this, is one way to support that.
Conventional treatments.
Yeah, so I don't think we're taking any questions yet, but maybe if you can remember that question, and then Jillian will get to it, yeah? So conventional treatments, unfortunately, when you go to the doctors, there's not a lot of emphasis on nutrition. Usually, by the time you're going to the doctor, you may have already presenting with a cancerous lesion, or there have been so much damage that's going on. There's a lot of mutation that's occurring. So usually the main modality is either to cut it out. You biopsy, you cut it out, or you use some form of chemotherapeutic type agent on the skin that kills that particular lesion, cancer cell, but unfortunately it also can kill some of the healthy cells around it, and therefore leaving a very bad scarring. It can also, the surgery can also unfortunately cause a spread of any of those cancer, if it is cancer, and it'll spread potentially into the bloodstream. So it's not the best way to go. I usually try to think, when I tell my patients, that I usually use surgery and any of those topical chemotherapeutic agents as a last resort, and you have to change your lifestyle prior to all of that before we can get to that. You don't want to use that. You want to use that as your last resort. You want to do all the preventable measures prior to that. And one of the other preventions is coming to see someone, some of these skin eco-Politan doctors, because we use a proprietary blend from Dr. Telleran, who has formulated it for many years. Probably he's been formulating for the last 20 years to make it as exact as possible so that it gets to the root of the potential cancer lesion that is there, and it doesn't harm any of the healthy cells around it. And therefore, once that lesion is removed, then healthy cells can begin to grow back into that area. it's the best way to, in my opinion, to go about treating something such as a precancerous lesion, or even if it's cancerous as well. And then, of course, changing your diet. And, another thing is stress is a huge, huge factor these days. I mean, we're not just stressed from our own thoughts, but we're stressed in the society. Our environment is stressed. We have lots of petrochemicals in the environment. We've got people that are constantly being exposed to environments with toxins, and that causes changes on the cells. So if you don't have a good, strong diet, and you don't have a lot of antioxidant therapy going on, then you're much more susceptible to having mutation changes occurring. And unfortunately, the skin tends to get the last of the antioxidant therapy, so that's part of the reason why we see such high rates of skin cancer, of the different kinds of skin cancers throughout in this world in particular. Do you want to talk about some other things?
Yeah, I think we covered some of the conventional and our treatment, and we have a booth here today, so we're going to be, we always do a free skin evaluation. So our job is to teach you what to look out for, and if we can't do it in this environment today, at least you can always come by the booth and we can look at your skin and talk about what to look out for, and that's a free 5 to 10 minute brief skin evaluation. And we can also treat on the spot. Treatment is so easy and effective, we can often treat one time on the spot, and the proceeds go to Dr. T's charity. So think about that. Did we talk enough about the conventional? Did we talk enough about treatments there? Does that make sense to everybody?
Well,
treatment options?
do you want to talk about more?
Well, I feel like that's probably it.
Did you have more questions about the different types of skin lesions? I'm just wondering, because who's got those cards? Yeah? If you don't have the cards that we were looking at, these cards, you can raise your hand and we'll get some to you. Okay, there was a volunteer. Is there a volunteer in this room? I'll bring them back to you, so you can just keep your hands raised when I walk back there, and I'll give you these. And then I wanted to just give you a chance to go over a few more of the common skin lesions, because I think that there's definitely some things that you might have questions of. Great, thank you. Of the more intense nature, but also I think one of the important things that I see a lot of people coming for is just things that you want removed because maybe you don't like the way they look, maybe you're worried, you think that they're not so pretty, or you want things removed. They might be uncomfortable in places that you feel discomfort. I know, like my mom had one removed under her bra strap that was kind of annoying. Dr. T did a demo of someone who had something removed from their tongue, which was really interesting. I didn't know that the medicine could work in that way. So maybe if you could comment just a little bit more on what's possible to have removed. Hold on.
Sure.
Thanks.
Yeah, so I've treated just about every lesion you can imagine, and all these on this card are lesions that we've treated and are gone. We should probably have a before and after card, but it works beautifully for cosmetic. Most patients, I would say, come in for more of the cosmetic most of the time, but as doctors, we're looking more for pathology and more of the riskier lesions, but we can treat both, and we often do. So the beauty of this treatment is we can treat eyelids, inside of eyelids, pretty much anywhere on the external part of the body, and sometimes a little bit in the internal part, depending on what we're talking about. So this is, it's an incredible, easy, and effective treatment. It's actually about an 80-year-old treatment that's Dr. T has augmented and perfected over the last 25 years, but it's been in dermatology for 80 years, and I think that it's just so low tech that it doesn't really exist much anymore. You'll see lasers and surgeries that are much more flashy and more expensive, but as Dr. Gabrielle explained, they're more inflammatory and risky for scars and lesions. Scars and inflammation around the tissue, and it's really overkill. So we can treat pre and active skin cancers on this. You'll see the pre-melanoma on here, and this is just meant to be an educational piece as well, up in the upper left corner. So you want to be looking out for those, and we treat them in the early stages. We can often avoid biopsies and surgeries Mohs surgery. If people have heard of a Mohs surgery, it's where they'll take a layer at a time, and that's kind of the latest, greatest thing in conventional medicine. And I'm not a big fan. It leaves quite often. Will leave quite a large scar because they'll keep cutting and keep until they're have clean margins below the lesion, which sounds great, especially to a doctor's ear. But what I've seen clinically, is pretty devastating. People with, generally. Sometimes, just holes in their skin. We have to have plastic surgery, and Dr. T has saved tens of thousands of people from Mohs surgery. And it doesn't mean they're not always indicated, but not as willy-nilly as they're done out there. So skin tags, let's go through our all the things that we can treat here, and we have treated successfully. So we can do birthmarks, actually. And often people will come in and say, well, this one's safe because I've had it my whole life. It's just a garden variety mole. And that's actually not true. The longer you have a mole, the more likely it is to be risky. And the risk is slight, but it does go up every year with more trauma. And trauma to a mole is trauma to your skin. Trauma to the skin is trauma to the DNA. And if that DNA changes, the cancer rates go up. Because DNA is supposed to be, it's a map to be what it's supposed to be for that particular cell. So what we see is trauma areas from sun exposed area, that's a trauma. The dietary fats we talked about, that's a trauma. A bra line or armpits, we see a lot of skin tags. And any lesion that sticks out is a tumor. Anything that sticks out, the medical term is tumor. Doesn't mean it's a cancerous tumor, but it's a tumor. And your brain has to map that. As part of the brain, it's called the homunculus, and the brain has an ability to map every surface, the whole entire surface of your body, and it's supposed to be by its original design, which is smooth. So if there's a bump there, that's extra neurological tissue that has to be mapped and become the new part of you. And the body really doesn't prefer that. We see when we remove lesions, we've seen anxiety decrease, which is very interesting. But usually we don't see that. Usually it's just more that it's not going to come back, and the body is now smooth, and it's the term for that, symmetric. And that's really how we're designed to be. So the skin should be smooth. And so I'm a fan of doing the cosmetic lesions as well, because they're really not cosmetic. If they're sticking out, that is a lesion that your body has to deal with, and that's a potential spot for trauma, again, from bumping and sun. So skin along the neck, from necklaces, and particularly armpits we'll see, and belt line. Those are areas, bra strap in the back, a lot of people get moles there. We just don't want to have moles getting banged around all the time. And so a mole is a nevus, and we have pretty much all know what those look like. And they can run in lots of different colors and shapes and sizes. Other lesions that aren't as obvious would be skin tags. Most people get skin tags as they age, especially with menopause and estrogen surges, and especially with diabetes and blood sugar dysregulation. We see that quite a bit. You might not be diabetic, but your blood sugar isn't very balanced, and you start getting skin tags. And those are the little tiny dots that pop out, are usually around the neck or the armpits, axillary area. So then, so condylomas is what this is viral, and that's like a viral or genital wart or anal warts. And this treatment is very effective for that. In fact, the original invention that's what it was for, was to treat those. However, not as effective on hard warts on the hands and feet. It will work, but it's much more complex. We have to shave those down every day and treat them, so it's not very effective for our style of treatment. And there are other effective treatments for hand, plantar, and palmar warts. So keratosis are usually, there's one picture on here, seborrheic keratosis is the most common mole, and it's the most common presentation we see. That's going to be really those kind of brown, usually stuck on, larger moles that we get with age. I call them the barnacles of aging, and you can see them anywhere on the body. Usually they're more on the face and scalp and the back. But they can be anywhere, and there's conditions, and there's a genetic predisposition. Some people form, thousands of them, and they start off tiny, and we can treat them when they're tiny or large. It's better to get them when they're small. When they get big, they're very oily. And so they tend to be harder to treat. They take a lot more time and and liquid. So get those when they're small, and they are treatable, and they are benign. They're not dangerous unless they're so big and so many that they're hiding a melanoma or something underneath. And melanoma, by the way, anything with color. So melanin comes from, that's the tan, that's tanning, that's a cell that makes melanin, which is the color. So any lesion with color in it potentially has the risk of becoming a melanoma. And so especially if there's color, we like to remove those. That said, it's usually not... it's very rarely a melanoma. What you want to look out for with a melanoma is something that's flat, like a freckle, and the size of an eraser tip or larger. So about a pea size or larger, that's flat and very dark. Usually they're quite black. And they start to get irregular shapes and some light brown coming off, or they itch a lot. Those are more of warning signs to get those checked out. We also do some of the other ones on here, telangiectasias, the hemangiomas. These are, again, associated with aging. And hereditary, so there's going to be a predisposition. They used to be called senile, and they still are. One of the names for hemangiomas are senile hemangiomas, because we get them with age. But we used to not see them until people were more senile, and now we see them more and more in younger ages. Even into teens are starting to pop out angiomas. And those are the little red dots, might be little tiny ones on your abdomen. They can get quite big and look like a mole, but they're bright red, and they're actually blood. It's a group of capillaries that are building up, and it has to do with antioxidant damage and blood sugar levels, because we're seeing people age much quicker because of our diet and lifestyle these days. Also on here we have xanthelasmas, or the fatty deposits you see usually around the eyes as we age. Sometimes they can be around the nose. Those are also called cholesterol deposits, and those are quite treatable, but also, again, benign, not dangerous, but it's a reflection that your diet isn't really working for you. We can do, and we also do quite a bit of lentigos or solar lentigos on here, or age spots or liver spots. So on the hand and the face, we'll often see those more in women with progesterone surges with pregnancy and menopause. We'll see those more and more, and those are treatable. They're much more shallow, so they're pretty easy to treat. And with our treatment, we also guarantee it. So anything that's treated will be retreated for free if it ever comes back. Most lesions are gone within about 2 to 4 weeks. That said, we always allow 3 months for full healing before we would ever retreat it, because some people heal slowly, and some lesions and locations, particularly lower on the body, the less circulation, the longer it's going to take to heal. So if you had a mole on your ankle, that might fall off in the standard 2 to 3 weeks, but it could also take a month to fall off, and it could take 3 months to heal. Versus on the forehead, it might take 7 days. So the face heals very quickly. People are often shy about their face, and don't be, because it heals the fastest and we get the best results on the face. Ears are another dangerous spot. You'll see the kind of crusty spots or red spots on the ears, or peeling, and that doesn't go away. Then that's likely a sun or solar damage, actinic keratosis, which is on here, which is a usually squamous cell carcinoma. Some others on here. I want to make sure I covered them. Skin tags, sunspots. Yeah, I think we got them. What's next?
Someone had a quick question? Yeah. Can you tell me the question and I'll repeat it? I'm going to say for that question, you should probably wait and talk to the doctors after. So let me just pre-frame this, because I want to say things that everyone's going to really get a lot of benefit from. And if you have specific questions related to your moles or those of your friends and loved ones that you want to ask about, whatever it is, the invitation right now is for you to come after this talk, and the doctors are both at the booth. We have a booth right in the center of the main room there, and they will give you, some of their time and look at your stuff and let you know what they think of it, whether they think it is dangerous or it isn't dangerous. Anything you want removed For aesthetic reasons, totally up to you. But they will give you their professional opinion on anything that's of a personal nature. So those types of questions I'm going to hold for now. And before I take the question of the woman in the back, I know you've been so patient. I wanted to just ask the doctors to share one more thing. And then we're going to talk a little bit about colon cancer too, because I know that's on the schedule also, and I do want to get into that and make some time for that. But just really quickly, would you just go over what the procedure is, and so that people know what they're getting into? I mean, you mentioned a little bit about the healing time, but just to give people an idea, because I know for me, the first time I did it, and which was like 6 years ago, I was like, what's going to happen? You know, is it going to hurt? How long does it take? What is it? You know, so it's really simple and really easy. So I'm going to just give them an opportunity to explain that.
Okay, so the treatment itself, the treatment is actually, we use a type of TCA, trichloroacidic acid, which a lot of estheticians and dermatologists all know about. It's been around, like I said, about 80 years. However, you can't just buy it and use it. It burns like crazy, and it needs to be buffered and mixed just right. And Dr. T has made a proprietary blend with, I think it was the head of the compounding pharmacy in Israel about 25 years ago, and they've got this blend perfected. So what we're doing is we're applying this liquid acid combined with some herbs. I don't know if it's poke root, or we don't know exactly what's in there, but it's buffered in a way that we can paint it on with a simple toothpick exactly where we want. So we don't have to hit cells we don't want to do, and it dries almost instantly, so that's why we can do eyelids and tongues. We've even done nipples and vaginal tissue and anal areas. So, I mean, it's incredibly effective and wonderful for us doctors to be able to have access to. I was going to say about that. When we apply it with the liquid, with the toothpick, it's going to dry almost instantly, and it will turn white, and that is constricting the capillaries. It's not just like we're putting any old acid on there. It's going to constrict the capillaries and treat down into the basal layer, typically of the epidermis. So on the skin, you have the epidermis, where almost all lesions exist, and then there's the dermis and the subcutaneous fat. So if over 90% of lesions just go into the epidermis and don't usually break the bottom, the basal layer or basement layer, and that's where basal cell carcinomas come from. So over 90% of the time, we're able to, in one treatment, get down into that basal layer of the epidermis by shrinking this lesion, by shrinking the capillaries, which is really anti-inflammatory. We're not cutting, burning, freezing where it's turning into an inflammatory reaction. We're actually shrinking and starving out the blood supply with the acid right to the exact depth that we want. And that's incredible, because we can be very precise and very specific with what we're doing. What else on that? So typically the way it's going to react is it'll turn into a scab without the blood supply, and it usually turns into a scab in about 2 days, and it usually falls off in about 10 to 14 days. And then under that scab, there's there's always brand new, fresh skin, and so sometimes it's pink. Usually it's pink for another week or potentially even 2 months if it's on the lower on the body, but now it's flat. Very rarely a mole will fall off and there'll be a little nub underneath, and we don't need to retreat that. It actually just keeps involuting and flattening out as the body maps. Is now able to freely flatten that skin out like it's designed, and so we rarely need further treatments. But I think we should probably jump into some of the colon cancer information. That's quite important. On that, before I hand over the mic here, I wanted to say that skin cancer is about 5 million people per year, so it's by far the most common skin cancer. It's more than all the other. It's more than all the other cancers put together. And colon cancer is unfortunately quite common in the U.S. and in the more non-vegetarian community. It's about 1 in 20, whereas skin cancer is about 1 in 5.
Just to lead into this, breast cancer has now become the #1 incidence in this country, followed by lung and prostate. But the third most occurring cancers is colon cancer. We see approximately 132,000 cases of colon cancer every year. Colorectal, that includes the rectal area as well. And it's also statistically the most deadly form of cancer because it can spread so easily because the colon has a huge vascular system. So there's an advantage of cancer in that area to spread much quicker. Plus the therapies that we've been performing. So I want to just talk a little bit more about maybe let's go into some of the symptoms of colon cancer. So we have, a lot of times people present and they'll come to see me and they'll say they've not been feeling too well. And a lot of times we don't see that there's any symptoms with colon cancer. A lot of times that is the case. But some of the general complaints that I would see weight loss, change in appetite, there's some weakness and fatigue, and then a change in bowel habits. So a lot of times people will notice that their stool, as they go to the bathroom, it tends to be a little more narrow. Sometimes they can have diarrhea. They feel like they're having incomplete bowel movements. The evacuation feels incomplete, and they may have several more throughout the day to have a full bowel movement. Again, sometimes you can see blood. We call it bright red blood per rectum. So a lot of times you see fresh blood in the rectal. You can see purple-colored stools as well. And then, of course, I see pelvic pain in the area. There's some chronic abdominal pain in the pelvic region. And then, of course, people experiencing gas and flatulence regularly. And let's see, did I cover most everything for that? Yeah, so do you have a question?
Well, I do have a question. I have a question, and I'm sorry that I thought we had a little more time than we have, and I know this is a big topic too, but I want to if we have probably about 5 minutes left, and again, I'll say the doctors are there. They're not there really to talk about the colon cancer issue. They are there to deal mostly with the skin evals for you, but we do have kits that are available, that are home testing kits. So, and I know that's what we want to make sure people know about, because this is very new information to a lot of people, and it's not widely mainstream. So it's really important that they share this with you right now. So I want to just give the doctors the opportunity to talk a little bit about why these kits are important, and why you would choose possibly to do this kit instead of a colonoscopy, and then where to get the kits.
So the latest that we've been doing is something called the M2PK test. It's a pyruvate kinase enzyme test. And basically the reason why we really want to emphasize this, it is a stool test, but what's most important is this is one of the best technologies that you can find on the market to help prevent colon cancer. So when you go into the doctors for your annual colonoscopy, if they tell you have a clean bill of health, doesn't guarantee that you don't have colon cancer. That is the problem, because colonoscopies are showing where there's tumors or where there's any protrusion in that, or any type of polyps. Any type of protrusion through that mucosal layer is going to show that there's potential cancer. However, the problem is if you don't see any of that on the colonoscopy, it doesn't guarantee that there's nothing underneath of those layers in the muscular layer of the colon. And that's where a lot of them are coming from. So with the M2PK test, it's a German-based test, which I love the technology because it tests for the specific enzyme that any type of colorectal cancers are secreting. So if you have high levels of this enzyme, then it's a very good likelihood that you do have colon. And it may not show up on the colonoscopy. So this is a preventable stool test that you want to get prior to this. If you experience any of these types of abdominal pain or change in your bowel habits, you want to do something like this, because they're also testing for something called FDH, which are inflammatory markers in the stool that also test to see if there's a lot of inflammation going on. So anyone if you have an irritable bowel syndrome, that doesn't guarantee that there's not cancer. But you have to really look at what your lifestyle's been, and if you have a lot of stress, the colon handles stress in the way of creating a lot of pain and changes in the bowel habits. So one thing I like also about this is it has a very high specificity and a high sensitivity for diagnosing pre-cancer. That's the most important thing, is what we're looking for is preventable measures here, and that's what I want to emphasize. We have about 6 or 8 kits. If anybody wants to get them today, we can give them to you for the cost, which Jillian... The cost is written on the paper. And there's no side effects or complications. It's just a stool test, and then it's going to test for all those inflammatory markers, which we can certainly talk more about, and also for that specific enzyme test. Anything else?
Good job.
You want to make a couple of closing comments, and then I'll just...
No, you can.
Okay. So again, thank you for coming. Sorry we ran out of time, but let me tell you a couple of things. If you didn't get and you want one of these info sheets on the M2PK test, come and see me or come to our booth. If you want one of the kits, the home testing kits, come to the booth. We have a limited number available today. And then there's an email address. I wrote my email address on top. I can get it to you or bring you some more tomorrow if you want to pick it up and I run out today. And then the doctors, I'm sure, if you stick around I know a lot of people are going to come and get your free eval of your skin tags or spots or things. Come to our booth right now, and this is the time to do that. We'll be here all weekend, but you can come right now. And then also, there's a mailing list going around. Who has the mailing list? If you haven't signed up on the mailing list and you want more information on when the clinics are and how to get M2PK tests and just when we're having great nutrition talks, sign up on that now too, and I'll make sure I get you that information also. So thank you again. Our booth is right in the center of the main room.